Now for rheumatic fever. This is a disease that can result after not treating strep throat or scarlet fever correctly, say from not finishing antibiotics or just not treating the infection. Either way, the untreated infection causes total body inflammation here, affecting the blood vessels as well as the joints, brain, skin, and also the heart, damaging the heart valves. So clients will typically present with a heart murmur, called rheumatic heart disease. So ATI mentions acute rheumatic fever. Which of the following assessments is the nurse's priority? Auscultating the rate and characteristics of the child's heart sounds. Now for the signs and symptoms. So in rheumatic fever, we see clients present with a sore throat, fever, as well as joint pain. So Hesse mentions, what assessments will the nurse include in a child's care plan with rheumatic fever? Sore throat in the past 2 to 6 weeks. Now in terms of labs, elevated CRP and ESR, which shows total body inflammation, as well as hemolytic strep, shows an active strep infection or streptococcus infection. And lastly, an anti-streptolysis O titer shows antibodies from a past or previous strep infection. So Saunders mentions laboratory results for a child with rheumatic fever. Expect to note which findings. Select all that apply. Elevated ESR, elevated C-reactive protein, that CRP, elevated anti-streptolysis O titer, as well as presence of group A beta hemolytic strep. Whew. Now, in terms of treatments, the goals of treatment is to kill the streptococcal infection and control the inflammation. So the provider will prescribe antibiotics like penicillin and often NSAIDs for inflammation. But again, we never give aspirin to our pediatric population here. Huge risk for Ray's syndrome. So Saunders mentions a rheumatic fever. The nurse notes that aspirin is prescribed. Which action is most appropriate? Consult the primary healthcare provider to verify the prescription. Yes, always verify aspirin for pediatrics. It's usually contraindicated because of that Ray's syndrome. All right, that wraps it up. Thank you so much for watching.